we're here at Nature's Dental with Dr. Olga. We're so happy to be here. This is such an incredible practice. Never seen anything like it in a dentist's office before. So Dr. Olga's going to give us a little tour.
So first you can have a seat here by a fireplace and enjoy some teas and refreshments. Plenty of seating area now. The kitties like to sit on the ottoman usually. We can put us here, so we'll have our front desk. Hi. And a couple operatories. That's our kitties room if you want to take a shot of the wall art. Some of it done by me, some of it done by our patients. We'll have a couple of giraffes ready to go. This is Maggie, she's doing computer work. Hi Maggie! Sterilization zone. And now we're going for the real deal. This is one of our amalgam removal rooms where we have all the equipment to make patients feel comfortable and anxiety free. We have diffusers going in each room and salt lamps that helps to filter the air naturally. We have a nice aroma, which you can't tell in the video. So you can follow me here. So we're about to bring our patient in and have them seated and drape them up and go from there. How are you feeling today?
Good.
Excited?
Yes, very.
Okay. So I know you probably your first time doing this. We always tell the patients how it's gonna go, so there's no surprises. Because we're gonna be wearing some funny gear, so don't make fun of us. Okay. I'll be wearing one of these amalgam filtering devices. You'll have the oxygen mask on while we're doing amalgam removal. Also, you have this beautiful raincoat that's called rubber dam, so it protects you from swallowing any mercury. So the tooth is going to be on this side, and we'll have the suction underneath, so this way you can still swallow normally. If at any point you need me to stop, or if you have a question, just raise your left hand, because I know you can't talk with all that gear on. We'll gear you up and get started if you have any questions, like I said, please. We could start putting the gear on, Chris. So you can put this in. So this will just basically stay on until we take the amalgam out, okay? The rubber dam will take off as well, so you could rinse. We'll have our gear. So until the amalgam is out, because we don't want you to breathe the vapors. That's mainly what that's for. But if any of it makes you claustrophobic, you just raise your hand, okay? So the oxygen, the rubber dam, and then we'll let you swish with some charcoal after. We're ready to go. All right, so and now we have my colleague, one of my colleagues, Dr. Diana Kopach. So she's awesome with kids. She has 4 kids on her own, so that kind of helps. So I wanted to ask you, what made you interested in this type of dentistry, the holistic biomimetic approach?
Sure. So, my family has always kind of embraced a holistic lifestyle. We love going on meditation retreats, and we stay from antibiotics as much as possible.
Awesome.
I'm definitely one of those moms who almost never gives her kids medicine. I stick to essential oils, doing Ayurvedic type of things. So when I learned straight out of residency that there is a biomimetic, holistic type of dental care, I was like, wow, this is right up my alley.
Yeah.
And I was blessed to be one of those few dental students that got to start this immediately out of residency. So I never learned, the bad ways of doing dentistry.
So you didn't have the 10 years of
Exactly.
they had
So
to
I was
go
able to
through,
just
and
do it.
that's really nice. And you got a privilege of working with Dr. Schwartzman, who trained you on site, who was
Yeah.
one of the
I was lucky enough to work with him for a couple of
biomedic
years.
dentists that were on Long Island. So yeah, that's awesome. We're really happy to have you.
Oh,
to
thank
help.
you. I'm so happy to be here, and I do love working with kids. You know, I'm kind of looking like a kid myself
Yeah.
at times. So
Both
they're not
are.
scared of me. They let me
Right.
do what we got to do, and everyone leaves happy.
So I also like to introduce my other colleague, Dr. Chitwan Gupta. She graduated from dental school in India, and since then she worked in India and then in US, and she did come across biomedic dentistry like we did as well, and she fell in love with it. She got the training, and she found a home with us. So tell us, what made you interested in biomedic dentistry?
So I've been practicing dentistry in USA for almost more than 5 years now, and on an everyday basis I saw a pattern, like deep fillings turning into root canals, turning into crowns leaking, teeth fracturing, and I really felt sad every time I got a tooth to put a crown on, because I was feeling like, you know, I was destroying the tooth structure. I really wanted to really preserve the tooth structure, and really wanted the skills to help my patients out to have their teeth, to preserve their teeth. And when I came across biomedic dentistry and I came across Dr. Olga and how she guided me towards, you know, getting the training, I was like, this is what I've been looking for all my life. This is the real healing that we can provide for our patients, for the teeth, and, you know, really help them. So
Well, it's excellent.
I'm
We're happy
so
to have you.
Yeah.